Welcome to Healthy Lifestyle Tips, where we explore different ways to live a healthier and happier life. Today, we are going to talk about a topic that most of us have indulged in at some point in our lives: alcohol. Alcohol is a popular social drink that is consumed by millions of people worldwide. While it can be a fun way to unwind and socialize, it is important to know what alcohol does to your body. Firstly, let's talk about what alcohol is. Alcohol is a psychoactive substance that is produced by the fermentation of grains, fruits, or other sugary substances. It is classified as a depressant, which means that it slows down the central nervous system, causing changes in mood, behavior, and cognition. When you consume alcohol, it is absorbed into your bloodstream through your stomach and small intestine. From there, it is transported to your liver, where it is metabolized. The liver can only process a certain amount of alcohol per hour, which means that if you drink too much, the excess alcohol will accumulate in your bloodstream, causing various effects on your body. One of the first things that alcohol does to your body is that it affects your brain. Alcohol consumption affects the brain in various ways, starting with impairing judgment, coordination, and reaction time. This is why people under the influence of alcohol should never drive or operate heavy machinery. Alcohol impairs the ability of the brain to process information correctly and efficiently, leading to slower reflexes and reaction times. Furthermore, the effects of alcohol on the brain can cause slurred speech, memory loss, and poor decision-making. These effects can last for hours after drinking and can be detrimental to an individual's ability to function normally. Slurred speech is a common effect of alcohol on the brain, and it can be difficult for others to understand what a person is saying. This is because alcohol affects the area of the brain that controls speech and communication. As a result, the muscles that control the tongue and mouth become relaxed, making it harder to form words and articulate them correctly. Memory loss is another effect of alcohol on the brain, and it can be short-term or long-term. Short-term memory loss can occur when an individual is under the influence of alcohol, and they may forget what they did or said while they were drinking. Long-term memory loss can occur when an individual drinks excessively over an extended period, leading to permanent damage to the brain. Poor decision-making is another effect of alcohol on the brain, and it can be dangerous in some situations. When an individual is under the influence of alcohol, they may make impulsive decisions without considering the consequences. This can lead to risky behavior, such as driving under the influence, engaging in unprotected sex, or getting into physical altercations. Alcohol can also affect your heart by increasing your heart rate and blood pressure. Alcohol consumption can have various effects on the cardiovascular system, and one of the most notable ones is its impact on the heart. When you consume alcohol, it causes a vasodilatory effect, which means that it widens your blood vessels, allowing more blood to flow through them. This causes a drop in blood pressure, which initially may seem beneficial but can lead to further complications. In response to the drop in blood pressure, your heart may start to beat faster to maintain an adequate blood supply to your organs and tissues. This increase in heart rate can be dangerous for people with pre-existing heart conditions or hypertension, as it can put extra strain on the heart and lead to further complications. Furthermore, alcohol can also cause irregular heartbeats or arrhythmias, which occur when the heart's rhythm becomes disrupted. Arrhythmias can be benign, but some can be serious and even life-threatening, especially in people with underlying heart conditions. These arrhythmias can include atrial fibrillation, supraventricular tachycardia, and ventricular tachycardia. Atrial fibrillation is the most common type of arrhythmia, and it is characterized by an irregular and rapid heartbeat. This can cause blood clots to form in the heart, which can then travel to other parts of the body, such as the brain, causing a stroke. Supraventricular tachycardia is another type of arrhythmia that can be caused by alcohol consumption. It is characterized by a rapid heartbeat that originates above the ventricles, and it can cause symptoms such as dizziness, shortness of breath, and chest pain. Ventricular tachycardia is a more serious type of arrhythmia that can be caused by alcohol consumption, especially in people with pre-existing heart conditions. It is characterized by a rapid heartbeat that originates in the ventricles, and it can cause symptoms such as fainting, chest pain, and even sudden cardiac arrest. Another effect of alcohol on your body is that it can lead to dehydration. When you consume alcohol, it is rapidly absorbed into your bloodstream through your stomach and small intestine. Once it reaches your kidneys, it inhibits the secretion of an antidiuretic hormone called vasopressin, which is responsible for regulating the amount of water in your body. This causes your kidneys to produce more urine than usual, which can lead to dehydration. Dehydration occurs when your body loses more fluids than it takes in, leading to an imbalance of electrolytes and a decrease in the amount of water in your body. Alcohol-induced dehydration can cause a range of symptoms, including headaches, fatigue, dizziness, dry mouth, thirst, and muscle weakness. One reason why alcohol-induced dehydration can cause headaches is that when your body loses too much water, your blood vessels can narrow, reducing the flow of oxygen and nutrients to your brain, which can cause headaches and migraines. In addition, dehydration can cause your brain to shrink slightly, leading to a headache. Another symptom of alcohol-induced dehydration is fatigue. When your body is dehydrated, it can lead to a decrease in blood volume, which can make your heart work harder to pump blood around your body. This can cause fatigue, weakness, and dizziness. Muscle weakness is another symptom of alcohol-induced dehydration. When your body loses too much water, your muscles can become dehydrated, which can lead to muscle cramps, weakness, and stiffness. This can make it difficult to perform daily activities or exercise. One of the most well-known effects of alcohol on your body is its impact on your liver. The liver is one of the most important organs in the body. It is responsible for filtering toxins and waste products from the blood, producing bile to aid in digestion, and storing energy in the form of glycogen. When alcohol enters the body, it is processed in the liver through a series of chemical reactions. The liver metabolizes alcohol through a process called oxidation, which converts the alcohol into acetaldehyde, a toxic substance that can damage liver cells. When the liver is exposed to excessive amounts of alcohol, it can become overwhelmed and unable to process the acetaldehyde efficiently. This can lead to the buildup of acetaldehyde in the liver, which can cause inflammation and damage to liver cells. Over time, this can lead to liver disease, which can be a serious and potentially life-threatening condition. The most common type of liver disease associated with alcohol consumption is known as alcoholic liver disease. This condition can progress through several stages, including fatty liver, alcoholic hepatitis, and cirrhosis. Fatty liver is the earliest stage of alcoholic liver disease and is characterized by the accumulation of fat in the liver cells. This can cause the liver to become enlarged and tender, and can lead to mild symptoms such as fatigue and abdominal discomfort. If the excessive alcohol consumption continues, the liver can progress to alcoholic hepatitis. This condition is characterized by inflammation and damage to liver cells, which can cause symptoms such as abdominal pain, jaundice, and nausea. In severe cases, alcoholic hepatitis can lead to liver failure and death. The most severe form of alcoholic liver disease is cirrhosis. This condition is characterized by the development of scar tissue in the liver, which can lead to the liver becoming shrunken and hardened. This can impair the liver's ability to function properly, leading to symptoms such as fatigue, weakness, and weight loss. Cirrhosis can also lead to the development of complications such as liver cancer, bleeding from esophageal varices, and hepatic encephalopathy. Alcohol can also affect your immune system, making it harder for your body to fight off infections and illnesses. It can also increase your risk of certain types of cancer, such as liver, breast, and colon cancer. In addition to these physical effects, alcohol can also have a significant impact on your mental health. It can worsen symptoms of depression and anxiety, leading to an increased risk of suicide. It can also lead to addiction, which can be challenging to overcome. So, what can you do to minimize the negative effects of alcohol on your body? Firstly, it is important to drink in moderation. This means no more than 1 drink per day for women and 2 drinks per day for men. Secondly, it is important to stay hydrated by drinking plenty of water before, during, and after drinking alcohol. Lastly, it is crucial to seek help if you or someone you know is struggling with alcohol addiction. In conclusion, alcohol can have a significant impact on your body, both physically and mentally. While it can be a fun way to socialize, it is essential to drink in moderation and be aware of the potential risks. Remember, your health is your most valuable asset. If you found this video informative, Please subscribe to Healthy Lifestyle Tips for more videos on how to live a healthier and happier life.